Dear medicos, welcome back. We are having Dr. Kartik Goel with us, rank 60 INICET examination. So, Beta Kartik, first of all, we congrats you on this platform for such
Thanks.
an awesome achievement.
Thank you so much, sir.
So, Beta rank 60, top 100 rank in INICET, कैसा फील आ रहा है बेटा रैंक के बाद?
सर काफी खुशी मिल रही है इस बात और मतलब इतनी बार ट्राई करने के बाद अब एटलीस्ट मिला है मतलब लास्ट नवंबर सेशन में 410 रैंक थी देन मई सेशन में 204 रैंक थी नीट में 520 रैंक आई देन इसमें अब टॉप 100 मार्क के काफी मतलब रिलीफ मिल रहा है कि आपको
That's great. After giving last 2 or 3 examination, now you got this rank 60 and I'm confident you will be getting your dream branch. So, Beta Kartik,
yes,
like
sir.
you are our foundation student, you are attached with us for the last 3 years in a foundation course. So you are the best candidate to tell all the juniors what should be the strategy and what should be, how we should play, how we should start the game in the third year itself and what should be the strategy. So let us use this platform. We wish you again very, you can say this achievement will be a big success for you, for your family, and we congrats you again on this platform. So let us start this session, and every medico who is listening to you, I feel he should take your word as a motivation. So better let us go back in 2018. Hanji.
Yes,
So
sir.
you started your journey with the DAMS. So how was the experience, like from the first lecture to the last lecture?
So in 2018, the lectures were of third and the final year because that year in college is also a lighter year. We can start the coaching and do most of the things in that year. And third and final year forms a main core in each of the entrance exams. The bulk of the questions also come from it, and we have to focus it in the lighter years. And we can learn it and do the MCQs then and there only. Uh, I won't suggest that one should start from first or second year because those are much more heavier years being from a Delhi University college, those are actually heavy years. In third year, as the course becomes lighter, we can start the coaching in the third year. And Saturday, Sundays coaching used to happen in the Krollbach Center, and all the lectures were of won't be much of longer duration based on the subjects. Each subject require like 1 week or 2 weeks that the subject would end, and those subjects we would make the notes. And my focus was to revise once half an hour, 1 hour after the class, so that a basic idea that what all topics were being taught. I won't suggest that one should revise it then and there for 6 to 7 hours. That won't be possible for anyone. Half hour, 1 hour at least to go through the what all topics were being taught in that particular class. And being a third year, in the third year subject used to get strong. Opthal, ENT, and PSM being easier subjects compared to the final year subject. The most of the classes were conceptual, but sometimes the subject being more of informative, we can't say that it can be conceptual. Like for my first class was with you, and I enjoyed ENT very much because the first class was anatomy of middle ear, which is actually a tough topic for everyone. I got to, and I still remember that you made us imagine the whole room as middle ear and taught the anatomy in 2 to 3 hours, and I still remember everything. I don't even revise that topic. I know that I've been taught it completely, and I don't need to revise it. So the concept building helps to retain it much more longer. And as and when based on each of the subjects, we tend to adapt that what concepts have to be learned and what some things you have to just rectify also. I can't. No one can say that things can't be rectified. We have to rectify some of the facts that is actually required. So that helped in the third year. And then in the final year, being a heavy year in the college, we are asked, I made the notes of first and second year. First and second year were actually easier for me because I've read most of the standard books in first and second year. So making the notes and revising it didn't take much more time. Simultaneously, I did some of the TNDs of third and final year in the final year itself. I won't suggest many should do because if you are free, you can do it. Otherwise, you shouldn't do it if the college studies are lacking behind it. So my after the final year, I did the END session in my internship year.
Internship. But what I'm getting from your words, like in the third year, you try your best to write all the notes of third year as well as final year subjects so that in the final year you will be able to revise the topics very nicely.
Yes, sir.
Now, but
Yes,
Kartik, like thanks for the compliment you are giving in the ENT lecture. You enjoyed the anatomy of middle ear and all those things. What was the role of concise notes in your success journey of 60?
Sir, the concise note helps to revise the subject in lesser time, because bulkier notes would take more time and would actually require more retention, and some of the useless facts which actually uh, an MBBS graduate shouldn't even know. Some of those facts which we aren't required to know. Why to waste time on those facts also? So the concise note helps in learning the subject much more better, and to revise it multiple times, because at the end we need to do multiple revisions. One reading or two readings aren't sufficient for any of the entrances. At least I think I did 3 to 4 times reading of the notes. It is actually required. And being so much delay, we have to revise it more and more. Otherwise, we'll tend to forget the facts.
So, but with
So concise note helps in it.
3 to 4 time of revision of the concise notes, you appeared for our TND in the internship after 2 years of exhaustive learning. So in the TND beta, now if I compare the MCQs of test and discussion with MCQs of the last INICT, which was one of the most tough exam, so how you compare these two MCQs level beta?
So most of the MCQs of the INICT and TND are based on the concepts. They don't ask that one-liners. They are last November it was more of one-liner, but now they are getting to the images, give the whole history and examination, and make the diagnosis or make the treatment based on it. So TND sometimes actually for some subject it would actually be tougher than the main exam, because that is to prepare that if the toughest questions also came, you know how to crack those questions. So TNDs help to prepare for the worst cases, like if they give the toughest exams in the recent exam, you are prepared that at least I know the basic, I can at least guess. I won't say make it correct, at least some correct guesses or some like tukka, like intelligent guesses would also help.
So we're like, apart from TND, you must have used our grand test, SWT. What
Yes,
was
sir.
the role of grand test and SWT, and how frequently you use, and what was the order? Like first you use SWT followed by GTs, and what was the order of this GT? What was the frequency of attempting GT in the first half, in the last half?
Sir, in GTs, I started from the month of Feb. At that time it would be monthly, and in the last 3 to 4 months it would be every 15 days,
Okay.
and in the last one I gave it every weekly.
Okay.
So in order, because at that time I was much more done with all the subjects, so I thought give it every weekly to have the habit of doing a 3.5 hours, because during the internship we were always told that it would be a paper of 3.5 hours with 300 questions. So our habit used to be of that only. SWTs should be done in the first reading. After the
Yes.
first reading of that subject, we can do the SWT and add some of the points, because SWTs contains some of the questions which are not being touched upon in more detail. Those points can be added, and after reading those multiple times, we can attempt the GTs. GTs help in that how to do a paper in that particular time, in the time frame, and we get to know which topics and which subjects are to be focused more,
Good.
like which subjects I'm making more mistakes, or sometimes it's not a subject, it's some topics, like which topics I'm making mistakes, or the like some of the students here that PSM ka mathematics wala part is tough, or some of those differential diagnosis wala part is tough. So we get to know that we have to focus more on that. And also the GTs help in that uh, basically what all focus should be there, like everyone knows that third and final year subjects make more bulk.
Well,
So why to waste time on those subjects which actually require less, which tend to come less questions? Like I won't suggest one should give 10 to 15 days for a psychiatry or derma subjects. Actually, they aren't being asked that much. We have to give them importance, but they require only 4 to 5 days. If we tend to give them more time, we'll get less time for medicine, surgery, and obstetrics, which actually make the bulk. So that also helps to see every GT or the previous in GT's previous year questions also are being added. So previous year questions like which topics are being asked more. So we
important.
have to focus on that also.
So whatever I am getting from your words, okay, you revise the class notes for the step should be like flowchart. If I'm making for your success from your words, okay, you take the class notes, concise, revise 3-4 times. In the first revision, you use SWT followed by GT, and with every passing day, the frequency of GT was on the higher side. You increase.
Yes,
Now,
sir.
if I compare like a level of the MCQs in GT, like your performance, was there a GT where you couldn't perform well, your performance was not up to the mark? It happened or no?
Yes, sir. So it happens
It
because
happened. And
my like frequency would be.
how you deal that hard time? Like every student asks this question, okay, sir, my score is not good in GT. So what should be the strategy followed by that if you can't perform well in GTs? Better.
So basically, I'll see why did I made a mistake. Like if I don't know the fact, so I can't correct it. If I don't didn't know the fact, some of the things like it was written in the notes, then also I made the mistake. Then one should be disheartened. Like it was written in the notes, why I didn't do it. So I'll go back to the notes, learn it again, and I will be prepared that I won't make the mistake in this topic in any further duty. And if I don't know the fact, at least learn it or write it. I, I won't say it's like you can write it again and again. Just learn it from those questions and just revise it, because those factual questions are form very less part, 4 to 5% of the questions. They don't come like 30-40 questions should be like those factual only. 5 to 10% question everyone has to take that. No one is 100% accurate. You have to take that. So don't one should be disheartened that I did 60% or 70%. If you're accurate in those, if the accuracy is good, then I think it's good. One should be more accurate rather than making that doing all the 200 questions and making more mistakes.
And how many MCQs you attempted in INICET? Beta? How many MCQs?
So in this 196.
196. That's great. You played very aggressive in the game, and because of which you got this rank 60. We are proud to share on this platform to have Dr. Kartik with us, and we again congrats him for this rank 16 last INICET examination. So, but I'm sharing your experience with DAMS. Like after 2 years of exhaustive learning, making your basic concepts, writing your notes, then followed by TND, GTs. In the last spell, you attended our DVT. How was the experience
Yes,
of
sir.
that DAMS visual treatment?
DVT was like it was literally different from all the other DVT, because I did it in the last year DVT. This was totally different, and I think it is one of the best method to revise. Those PDFs, if you first do the videos and after those PDF, one can revise the subject, the whole course in 15 days time. The DVT PDFs would actually help, and many questions come directly from the DVT. Some of the sports, some of the images, like directly pick up from those questions, and some of the like key hacks. Every teacher used to tell, like if those two symptoms are there, mark this. That is not given in the notes, but we get to know that if those 2 and 3 symptoms, make the diagnosis and give the answer. No one is no During exam, no one can read that whole 10 to 15 lines. No one can do it. Otherwise, we can't complete the exam. So those hacks actually are given in the review.
Those
So it
keywords
is. Yes,
I'm
sir.
getting from your words that the keyword helps a lot in attempting the MCQ.
Yes,
You
sir.
should focus on the keywords in the last spell. And DVT, yes, it was very innovative to learn in an integrated way. Like pattern is
Yes, sir.
changing better from the one-liner pattern is changing to clinical integrated MCQ. So like we integrated everything in the DVT. That integration, that integrated approach help you a lot in getting rank 60. And what should be the
Yes, sir.
strategy like in the upcoming days? If I give you option, okay, you're going for the upcoming NEET examination in the month of March, what should be your strategy like? What all the medicals listening to you, how they should proceed in the upcoming days with?
The, sir, if one has done, reading should be completed by December. Then all the rectification things. And GT should be given every 15 days now. Not, I would say, it's every month. In the last, one should also know that what part I'm weak. Like I know that in biochem, tend to forget the enzymes and the disease. Write those topics that one should be doing in a 10 to 15 days. That rectify all those things and just vomit it out. Obviously, no one can just remember all those. Like in this exam, the green cannula flow rate came. No one can remember those flow rates 2 to 3 months back. Just remember 10 to 15 days and just forget it. So those uh, everyone knows that what part I'm weak in and what I have to rectify. So I can't give a particular list that you have to rectify all those things only. That is why the GTs tell that we tend to know what all things are to be rectified at the last. So one should be doing the GT every 15 days and the last one every weekly. So that would actually help. And revising those GTs in a 1 day time. Don't stretch it 2 to 3 days. And if it takes more time, focus on the mistakes and the guess questions. Not focus on the correct questions, because actually you made those correct based on your own knowledge. Those you didn't made a guess. You know that topic, that is why you made it correct. So focus on the mistakes and the guess questions. That actually helps me.
That should be the approach. So, better, like after appearing for all these sessions, you must have went for CBT. How was the experience of CBT examination in your INICET and NEET examination?
So CBT helps firstly, like where am I standing in the whole country, and basic idea what if I will giving the exam, what rank I would be uh, I will achieve in it. And those CBTs actually help to they have video explanations also. So I get to know that what mistakes I made and what was my thinking during that question and what I should not be thinking. Like I sometimes I would think much more in depth, and it isn't required in. Sometimes we get to know it, and like I would miss out some of those words like true except, false except, and make mistakes in that. Like some of the option, how to ruling out the options also helps. Like a age groups, if a particular age group is given the question, one or two options automatically gets ruled out in it. So we get to know like that only a video or teacher would tell that how to rule out those options. Ruling out options can't be done by the notes only. That can be done only after giving mini tests and doing the questions.
Very good. Where I'm getting from your words, the keywords play important role, like age of the patient,
Yes, sir.
age of the patient. We should focus on these in the last spell. But at the end, any special message for the DAMS faculties and what you feel, what role they played in your success journey?
So DAMS faculty helped in giving all the classes and the prolonged classes and continuously telling us that where and how to approach a particular subject. Uh, I would say like if you aren't happy with a particular subject, try to approach the faculty. Try to ask that I didn't get to understand it. Don't delay it to the internship year or afterwards. Afterwards we all just do it like oh jo ho gaya so ho gaya. So if you can't understand a particular subject, ask from the faculty then and there only. Like I didn't understand psychiatry much in that particular year, so I asked Sachin sir to teach some of these things. And I did TND session in the final year also, and in the internship year. So more or less that my notes are much more thick, and I tend to know the subject in detail. Uh, just delaying the things more and more won't help. If we start to delay, we'll actually are making us ourselves to drop another year. Actually, this won't be a drop year, but it happened based on all of the postponements.
But at the end of the year, when you are getting rank 60, but everything is, you can say, we can thank God for getting such a rank, even if the exam was prolonged and everything. And if you're getting a good rank, but at whatever ends well is a great achievement. So we again congrats you for getting this rank 60. And what I'm getting from your words, all the DAMS faculties are approachable. You should clear all the doubts on the same day rather than postponing all the things. But what I'm getting.
Yes, sir.
That's great, beta. And Kartik, at the end, any special message for your family on this platform?
So my family helped in like after all these classes, like I would be attending Saturday Sundays also, even after the college. And in this whole year, where all the exams were being postponed, my family helped to how to just cope up with it. Even after getting a 204 rank, I was tense, like whether I should drop or not. So my family supported that if you are sure, you just do it. You know how to do the subject and you know how to do the entrance. You can achieve a good rank and you can get a particular rank and your desired branch also. So my family supported my all my decisions I took for myself, and all the classes I took. They didn't put any hold that if you are taking a particular class or you are taking a 12 to 13-hour class, it is difficult for us to manage with it. So they all helped me.
Thanks, Beta Kartik, for giving valuable advice for all the juniors. And we again congrats you for such an awesome achievement. We wish you very best of luck on this platform on the behalf of DAMS family. Best of luck, Beta. Best wishes, Kartik. Thanks a lot.
Thank you so much, sir.
Thank you.
Thank you so much.